Have you ever wondered how often is the right amount of bathing is for someone in their golden years, especially if they're over 82? It might surprise you to learn that the answer isn't as straightforward as you think and could even go against what you've always believed. Stick around until the very end because we're about to reveal 7 shocking facts about senior hygiene that could significantly impact the health and well-being of your loved ones, or even yourself one day. You won't want to miss these crucial insights that challenge common misconceptions and offer valuable knowledge you can apply right away. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. How often should seniors over 82 bathe? For seniors aged 82 and older, maintaining personal hygiene is essential for both physical health and emotional well-being. However, the frequency of bathing for this age group often differs from younger individuals due to changes in skin physiology, mobility, health conditions, and lifestyle. As a general guideline, bathing once or twice a week is typically sufficient for most seniors over 82 to stay clean, prevent skin infections, and avoid issues such as body odor. This recommendation balances hygiene needs with the potential risks of overbathing, which can exacerbate skin issues common in older adults. Below, we explore this topic in greater detail, including factors that influence bathing frequency, potential risks, and practical considerations for ensuring safe and effective hygiene practices. As people age, their skin undergoes significant changes that impact how often they should bathe. Thinner, drier skin. With advancing age, the skin becomes thinner, less elastic, and produces less natural oil, sebum. Frequent bathing, especially with hot water or harsh soaps, can strip away these oils, leading to dryness, irritation, or even cracking, which increases the risk of infections. Reduced sweat production. Seniors often sweat less than younger individuals, meaning they may not accumulate body odor or dirt as quickly. For those with sedentary lifestyles, weekly bathing is often adequate to maintain cleanliness. Fragile skin. The skin of seniors over 82 is more prone to tears, bruises, and injuries. Excessive bathing or vigorous scrubbing can damage delicate skin, particularly if mobility issues make it harder to bathe safely. Health and energy conservation. For many seniors, bathing can be physically taxing due to reduced strength, balance issues, or chronic conditions like arthritis. Limiting full baths to once or twice a week can help conserve energy and reduce the risk of falls, a leading cause of injury in older adults. While less frequent bathing is often sufficient, it's important to supplement with targeted hygiene practices, such as daily sponge baths or cleaning of specific areas, e.g., underarms, groin, and feet, to maintain overall cleanliness. The ideal bathing schedule for a senior over 82 depends on individual circumstances. Below are key factors that may necessitate adjustments to the general recommendation of 1 to 2 baths per week. Activity level. Seniors who remain physically active, whether through walking, light exercise, or social activities, may sweat more and accumulate dirt or bacteria on their skin. These individuals may benefit from bathing more frequently, such as 2 to 3 times per week, to stay comfortable and odor-free. Conversely, those who are bedridden or have limited mobility may require fewer full baths but more frequent partial cleaning to address specific areas prone to moisture or bacteria buildup. Incontinence. Seniors with urinary or fecal incontinence may need more frequent cleaning of the genital and perineal areas to prevent skin irritation, rashes, or infections like urinary tract infections, UTIs, or yeast infections. Daily cleansing of these areas with mild soap and water, followed by thorough drying, is often necessary, even if full baths are less frequent. Caregivers or family members should ensure that incontinence products, e.g., pads or briefs, are changed regularly and that the skin is kept dry to avoid complications like pressure sores. Skin conditions. Certain medical conditions, such as eczema, psoriasis, or fungal infections, may require a tailored bathing schedule based on a healthcare provider's advice. For example, some conditions may improve with more frequent, gentle cleansing, while others may worsen with excessive water exposure. Seniors with extremely dry skin, xerosis, may benefit from fewer baths and the use of moisturizing cleansers or emollients to lock in hydration. Medical conditions. Chronic illnesses, such as diabetes, can increase the risk of skin infections, particularly in areas like the feet or skin folds. These seniors may need more frequent cleaning of high-risk areas, even if full baths remain weekly. Seniors with wounds or pressure ulcers require specialized care, including gentle cleansing around affected areas, as directed by a healthcare professional. Personal preference and emotional well-being. Some seniors may feel more comfortable or confident with more frequent bathing, even if it's not strictly necessary for hygiene. As long as it's safe and doesn't harm the skin, accommodating these preferences can support mental health and dignity. Conversely, others may resist bathing due to discomfort, fear of falling, or cognitive issues, e.g., in cases of dementia. In these situations, caregivers should approach bathing with patience and flexibility, possibly using alternative methods like sponge baths to maintain hygiene. Environmental and seasonal factors. In hot, humid climates or during summer months, seniors may feel the need to bathe more often to stay comfortable and prevent skin irritation from sweat. In colder, drier climates or during winter, less frequent bathing may be better to avoid exacerbating dry skin, with an emphasis on moisturizing after each bath. Risks of overbathing. While maintaining hygiene is crucial, bathing too frequently can pose risks for seniors over 82. Dry skin and irritation. Excessive bathing, particularly with hot water or harsh soaps, can lead to dry, itchy, or inflamed skin. This can create a cycle where seniors scratch irritated areas, increasing the risk of infections or skin breakdown. Increased fall risk. Bathing often involves navigating wet surfaces, stepping in and out of tubs, or standing for extended periods, all of which increase the risk of falls. Limiting full baths reduces these opportunities for accidents. Skin infections. Overbathing can disrupt the skin's natural microbiome, making it more susceptible to bacterial or fungal infections, especially in areas like skin folds or between toes. Fatigue. For frail seniors, bathing can be exhausting. Overdoing it may lead to physical exhaustion, reducing their ability to engage in other daily activities. To mitigate these risks, seniors and caregivers should focus on gentle cleansing methods, such as using lukewarm water, mild fragrance-free soaps, and patting, rather than rubbing, the skin dry. Applying a fragrance-free moisturizer immediately after bathing can help lock in moisture and protect the skin barrier. 7 surprising facts about bathing for seniors. Bathing is a vital daily task, but for seniors, it requires careful adjustments to accommodate changes in skin, mobility, cognition, and overall health. Below are 7 surprising facts about bathing for older adults, presented with in-depth explanations, practical tips, and strategies to ensure safety, comfort, and dignity. This guide is designed for caregivers, family members, or seniors themselves, aiming to provide a comprehensive and useful resource. 1. Daily bathing can be harmful. The skin of older adults undergoes significant changes, making daily bathing, especially with hot water and harsh soaps, potentially more harmful than beneficial. As we age, the epidermis thins, natural oil, sebum, production decreases, and the skin's protective barrier weakens, leading to dryness, itching, and cracking. A 2018 study in the Journal of the American Geriatric Society found that over 40% of seniors experience chronic dry skin, often worsened by improper bathing habits. Hot water strips away natural moisture, while soaps with high pH or fragrances can disrupt the skin's natural barrier, pH around 5.5, causing irritation or allergies. Cracks in dry skin can become entry points for bacteria, leading to infections like cellulitis or fungal growth, especially in seniors with diabetes or weakened immune systems. To protect the skin, seniors should limit full-body baths or showers to 2 to 3 times per week, unless conditions like incontinence require more frequent cleaning. Use warm water, 95 to 100 degrees Fahrenheit, instead of hot water to avoid dehydration and reduce burn risk, as seniors often have reduced temperature sensitivity. Choose gentle, fragrance-free, pH-balanced cleansers with moisturizing ingredients like glycerin or ceramides. After bathing, apply a thick, fragrance-free cream containing petrolatum or hyaluronic acid within 3 minutes to lock in moisture. Pat the skin dry with a soft towel, avoiding rubbing that can irritate. For those with skin conditions like eczema or psoriasis, consult a dermatologist for tailored care plans, including medicated creams or antifungal treatments if needed. 2. Falls are a major risk. The bathroom is one of the most dangerous areas in the home for seniors due to slippery surfaces, tight spaces, and the physical demands of bathing. According to the U.S. Centers for Disease Control and Prevention, CDC, About 1 in 3 adults aged 65 and older falls at least once annually, with over 30% of these incidents occurring in the bathroom. Common scenarios include slipping when stepping into or out of a bathtub, losing balance while moving from sitting to standing, or tripping on wet floors. These falls can lead to serious injuries like hip fractures, over 300,000 cases yearly in the U.S., traumatic brain injuries, or sprains, significantly impacting independence and quality of life. Seniors with arthritis, muscle weakness, or neurological disorders, like Parkinson's, face higher risks due to impaired balance. Vision issues, such as cataracts or glaucoma, increase the chance of misjudging steps or missing obstacles. To reduce fall risks, install sturdy grab bars near the toilet, bathtub, and shower, ensuring they support at least 250 pounds and are anchored to wall studs. Use non-slip mats or adhesive strips inside and outside the tub, checking them regularly for wear. Shower chairs or transfer benches allow seniors to bathe seated, reducing strain and balance issues. A handheld shower head is a helpful addition. Ensure the bathroom has bright lighting, at least 100 watts or LED equivalent, and install motion sensor nightlights for nighttime visits. Remove tripping hazards like loose rugs, toiletries, or cords, and wipe up spills immediately. For those with significant mobility issues, consult an occupational therapist to assess and recommend bathroom modifications, such as walk-in showers or low-step tubs. A waterproof medical alert button in the bathroom provides quick access to help in case of a fall. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Routine can help with dementia. For seniors with dementia, including Alzheimer's disease, bathing can cause anxiety, confusion, or resistance due to cognitive decline, sensory sensitivities, or fear of unfamiliar sensations like water. The Alzheimer's Association reports that over 6 million Americans live with Alzheimer's, and many resist personal care tasks as the condition progresses. A regular, predictable bathing routine offers stability and familiarity, reducing stress and opposition. However, forcing a bath during moments of fear or confusion can heighten distress, making future attempts harder. Flexibility, patience, and understanding emotions are key to meeting their needs. Seniors with dementia may misinterpret bathing, perceiving it as threatening due to impaired reasoning or sensory overload, e.g., from running water. Schedule baths when the senior is most calm, such as after breakfast or a favorite activity. Break the process into small, clear steps, explaining gently, e.g., "Now we'll wash your hands." Create a soothing environment by reducing noise, playing soft music, or using warm lighting. If water causes fear, use no-rinse cleansing foams or warm, damp towels. Encourage participation, like holding a washcloth, to foster control. Use the same caregiver when possible to build trust. Watch for distress signs, e.g., pacing or verbal protests, and pause if needed, redirecting with a song or story. If resistance persists, consult a geriatric psychologist or dementia care specialist for tailored strategies. 4. Sponge baths are effective. For seniors facing physical or emotional barriers to showering or tub bathing, such as limited mobility, chronic pain, serious illness, or dementia, sponge baths, or bed baths, are a highly effective and practical alternative. A 2020 study in geriatric nursing found that sponge baths are as effective as showers for maintaining skin cleanliness in bedbound patients when done correctly. This method focuses on areas prone to odor or bacteria, like the armpits, groin, genitals, and skin folds, while reducing physical and emotional stress by avoiding bathroom transfers or slippery surfaces. To perform a sponge bath, prepare a basin of warm water, 95 to 100 degrees Fahrenheit, mild soap, several soft washcloths, towels, disposable gloves, if needed, a blanket for warmth, and fragrance-free moisturizer. Keep the room warm, at least 70 degrees Fahrenheit, to prevent chills. Cover the senior with a blanket or towel, exposing only the area being cleaned to maintain privacy and comfort. Start with the face and neck, then move to the chest, arms, legs, and finally the genital area, using a fresh washcloth for the latter to avoid cross-contamination. Rinse soap with a damp cloth and pat dry gently. Use no-rinse foams or wipes for sensitive skin if water is impractical. Check the skin for redness, sores, or odors, and report concerns to a doctor promptly. Sponge baths can be done daily for key areas or every other day, paired with full baths when feasible. Family caregivers should learn techniques from a nurse or therapist to ensure hygiene and safety. 5. Hair washing isn't always necessary. Aging impacts the body's ability to regulate and sense temperature, making it hard for seniors to detect if water is too hot or too cold. Those with conditions like diabetes, peripheral neuropathy, or stroke may have even less sensitivity. The National Institute on Aging notes that burns from hot water are a leading injury cause in seniors, with over 1,000 cases reported yearly in the U.S. Water above 120 degrees Fahrenheit can burn fragile skin in seconds. Conversely, cold water can cause chills or hypothermia, especially in those with poor circulation or low body fat. Medications like beta blockers or sedatives, common in seniors, may dull temperature perception, while conditions like hypothyroidism impair thermoregulation. Set the water heater to a maximum of 120 degrees Fahrenheit, as recommended by the U.S. Consumer Product Safety Commission. Use a bath thermometer to verify water temperature, aiming for 95 to 100 degrees Fahrenheit. Caregivers should test water with their hand or elbow before assisting, as these areas are more sensitive than fingertips. Install thermostatic mixing valves or anti-scald devices on faucets to prevent sudden hot water surges. Monitor conditions or medications affecting temperature sensitivity, and consult a doctor if burns or chills occur often. After bathing, dry and dress the senior quickly to maintain warmth, especially in colder climates or seasons. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 6. Adaptive equipment enhances independence. Adaptive equipment can greatly improve seniors' ability to bathe safely and independently, reducing reliance on caregivers and boosting confidence. A 2021 study in the Journal of Aging and Physical Activity found that assistive devices can cut fall risk by up to 50% when used properly. From simple tools to advanced setups, these solutions fit various needs and budgets, helping seniors maintain control over personal care. Useful devices include long-handled sponges or brushes to reach tough areas without bending, transfer benches to slide safely into tubs, walk-in tubs or zero-threshold showers for those with mobility issues or wheelchairs, handheld shower heads with gentle spray settings for sensitive skin, wall-mounted or pump soap dispensers to reduce gripping, ideal for arthritis, water-resistant non-slip shoes for better traction, and textured grab bars for easier gripping. Consult an occupational therapist or home modification specialist to assess needs and recommend equipment. Some devices may be covered by insurance, like Medicare, with a prescription. Ensure equipment is professionally installed, e.g., grab bars anchored to studs, and train seniors on safe use. Regularly check for wear, like loose screws or worn non-slip surfaces, to maintain effectiveness. 7. Bathing is a social and emotional experience. Bathing is not just about hygiene, but also a chance to meet seniors' emotional and social needs. For those needing assistance, it can evoke vulnerability, loss of independence, or embarrassment. However, with respect and empathy, it can become a moment of connection and dignity. A 2022 study in The Gerontologist shows that positive caregiver interactions during personal care improve mental health and reduce isolation. For seniors living alone, bathing may be a rare moment of touch or care, making it emotionally significant. Communicate gently, explaining each step and asking permission before touching, e.g., "Mary, may I help wash your back?" Respect privacy by covering areas not being cleaned and letting them do what they can independently. Encourage choices, like picking soap or towel color, to foster control. Turn bathing into a bonding opportunity by chatting, sharing stories, or recalling memories, like childhood bath routines. If resistance arises from shame or fear, explore underlying causes, e.g., past trauma, and address them patiently or with professional help. Trained caregivers skilled in person-centered care may be ideal if family assistance causes discomfort. Consider cultural or personal preferences, like same-gender caregivers or familiar products, to enhance comfort. Alright, let's wrap things up. We've taken a deeper dive into the often overlooked topic of bathing for seniors, specifically those over the age of 82, and hopefully, you've gained some valuable insights. We've highlighted how less is often more when it comes to frequency, the significant risks associated with falls in the bathroom, the nuances of care for those with dementia, and the effectiveness of simple methods like sponge baths. Remember, the key takeaway here isn't a one-size-fits-all answer, but rather a call for mindful and personalized care that prioritizes safety and comfort above rigid routines. Now, we're curious to know what resonated most with you. Was it the surprising statistic about bathroom falls? Or perhaps the understanding that daily bathing isn't essential and might even be harmful? Take a moment to reflect on what you've learned, and down in the comments section below, share just one key insight that you plan to incorporate into your approach, whether it's for a loved one, a patient, or even considering your own future needs. Your experiences and shared knowledge can be incredibly valuable to others in our community. If you found this video informative and helpful, please take a moment to show your support. Leave us a comment sharing your thoughts. Give this video a thumbs up to let us know you appreciated the content, and if you haven't already, hit that share button to spread this important information to those who might benefit from it. Lastly, and most importantly, don't forget to subscribe to our YouTube channel for more in-depth discussions and practical advice on senior care and well-being. We regularly upload new videos packed with valuable information, and we wouldn't want you to miss out. Thanks for watching, and we'll see you in the next video.